Hello, hello. I'm coming to you virtually to talk to you about foot injuries. This is going to be our chapter 14. We're going to go over chapter 15 in the next PowerPoint that I'm going to show you, as long as all things go well. Starting off, a lot of the foot anatomy is going to be broken up into a couple different pieces. I'm just going to explain really quickly here. We have phalanges, which is pretty much the actual bendable portions of the toe that is interconnected into the actual toe. Imagine my hand is actually a foot. Now we have metatarsals, which slightly go a little further down. These you cannot bend. That is the actual portion of the foot that does not bend. And then broken up into tarsals, which are formerly known bones, such as the cuboid, navicular, and the like. So our arches are actually broken up into these metatarsals, transverse tarsal bones, as well as a couple of other the calcaneal bones that go along the side, connecting our third, fourth, fifth toes together. After that, we actually have a layer of plantar fascia, which connects from the posterior portion of the foot to the anterior portion of the foot on the distal portion, or the bottom of the foot, as we would like to call it. And so that's kind of what makes up the actual visible portion of that arch. It's not more anatomically seen as compared to a fascial plane view, which is what we can visually see. A lot of the muscles that we do have in the foot, if we're going down here, are pretty much, you're not going to have to know this anatomy wise. We just call them the flexors, extensors, the peroneals, which actually wrap around the side of the ankle, and the tibialis anterior tendons. There's a couple of them, but that's just how we go by them. Starting off with one of the first injuries we could actually get, it's actually going to be the heel bruise. You're not going to find this a lot with athletes. The main type of athletes you would see this with is probably going to be basketball players and gymnasts. It's basically going to be people that have any type of high impact or jumping capability. Again, like I said, it's rare because most of the time people aren't landing on their heels. As an athlete, you're going to primarily land toes first, so not a problem. You might see it in older people, though, just because as their bodies break down, you're actually going to see deterioration among many things. Some of those things are going to be the fat pads on the bottom of the heel. It'll start to deteriorate and then be flushed out as regular tissue into the rest of the body. I know it's not being shown here on my screen, but pretty much the best way to treat this is by using some type of donut pad or pretty much a piece of foam with a circle in it to try and take some of the pressure off of that style of foot. Now, as you can kind of see on screen here, that little blue pad, that's actually a hollow point in there. That way the pressure is actually being distributed to the rest of the gel on the outside. So no direct pressure is actually being applied to the heel itself, allowing that cushion to kind of take the pressure off the heel. If you ever try and just go outside and walk on your heels on concrete barefoot, it can be a little uncomfortable. Pretty much imagine that, crank it up 10 times, and just walking plainly is what would cause that type of pain. It's really that sensitive because without that fat pad there, you're pretty much walking on nerves. This picture is trying to kind of summarize it a little bit better, that the nerves are touching without that fat pad there. That's the gist of that. Moving on, we are now on to plantar fasciitis. So plantar fasciitis is pretty much a itis. Again, that is a swelling or inflammation of the tissue itself, and you can most commonly find it during its origin, or where it kind of starts along the body rather than it's an insertion near the end, mainly because origin-related injuries are more common with the plantar fasciitis. You're going to see this in a lot of runners and a lot of jumpers. Pretty much as you are performing more and more activity, you're going to see a lengthening of this plantar fascia due to the fact that the muscles surrounding the foot are either getting fatigued or you're doing pretty much too much exercise and you are chronically stretching it out, causing a lot of bad arches. And that poor arches is going to keep that thing stretched out. So it's almost like causing permanent flat foot. And so once you have that permanent flat foot, the tendon, not tendon, but fascia is pretty much forcing itself to stay into a lengthened position at all time, which is painful for it. So with something like this, you're actually going to notice it's going to hurt more in the morning than it will later on in the day. The reason being is that with this type of tissue, as you rest it, it'll start to shorten up and contract and get nice and tight. And then as soon as you start using it, this tight, irritated tissue is now getting stretched out again into this painfully lengthened position, almost like a strain, where I said earlier that stretching is actually going to make it feel more painful. That is the same principle of the matter. So, best thing we'd actually do for something like this, I'm covering it again, but you'll have access to it on your screen, actually rolling it out with some type of hard ball, like a lacrosse ball, during the mornings to try and just roll out that tissue, get it slightly lengthened, get all the knots and stuff out of it, and then following it up with some stretches like soleus and gastroc stretch, as well as just trying to do some type of supportive taping or inserts to try and reform that arch and give it that strength back so that it is not permanently lengthened or shortened at night, can help out with this condition. Next injury that we have here is called turf toe. This one will be a bit more common depending on the sport that you're playing compared to plantar fasciitis. Pretty much it is a tear of the ligaments on the bottom portion of MTP joint, where pretty much the metatarsals will meet the phalanges. It's pretty much a hyperextension of the big toe. Now, it is not shown on here, but there is a style of bones called the sesamoid bones. If you were to look that up anatomically, you'll notice that it will be above those sesamoid bones where it's most common to tear. This style of injury, you can plan it due to the fact that it is a to tolerance style injury. And because of that, you'll be able to play with it, or you can tape it to try and assist or resist that style range of motion. That way it is easier for you to move through it. If the pain tolerance is too high, we can actually try and use some type of brace or device, most commonly a boot actually, because it is easier to find and use compared to these devices in order to try and hold the toe in place. Next up, we have bunions. So bunions is a inflammation style injury that can occur to the bursa, or it can be an actual anatomical movement of the foot itself in a certain direction. Now, I'll get into that a little bit in a second, but pretty much what happens is the bursa and the bone on the outside of the MTP joint will actually start to thicken or widen out. I told you how bursa is a localized style injury, will literally grow out. But due to the inflammation and the anatomical shifting that I told you about, with this bursa growing out in this mild section over here, and then slowly growing out further and further as you see all the way to the right, you'll actually notice that the toe, big toe, slowly starts to shift inward and underneath this big toe on the far right-hand side. Now, the reason that this happens is because, like I said, that anatomical shift is actually occurring and it is slightly moving inward. All right, so I know it doesn't actually state it here, but that is what happens. Now, most of the time, you're going to get this from wearing narrow toe box shoes or performing any type of exercise using narrow shoes. Pretty much, the foot doesn't have enough space for the toes. Anatomically, those toes are going to try and go in on themselves, and this is what occurs because of that. So, a lot of times, one of the biggest treatments is using some type of donut pad to pad up that area just so that we can reduce the pain, not treat it. We're trying to treat the symptoms here at this point, not the style of injury. Rice afterwards. Change the style of shoes you have so that they're more flat, have a wider toe box, NSAIDs to help deal with the pain, and surgery. Now, this is undocumented, but obviously some people can try and change this early on in the moderate and large stages by simply trying to use toe spreaders or toe spreading exercises to try and physically put it back in place. The bursa, since it is a fluid sac, can calm down on its own, and anatomically speaking, you can deal with the inflammation and the correctiveness of the foot on your own as long as it is not late stage enough. Moving on, like I said, we have sesamoiditis. We have two small bones that are actually floating bones similar to our patella that is in our knee. These sesamoids actually help with that toe flexion like I talked about earlier with the turf toe style injury. Pretty much whenever those don't move well, you get inflammation. And those floating bones can actually cause rubbing and irritation alongside the rest of the bones that move along that joint. A lot of times you'll actually see false signs of turf toe, implicated with sesamoiditis. But the one thing that you'll actually look out for is a deformity of the toe, where it will be pointing slightly up or down with turf toe. Whereas with sesamoiditis, it will still point straight along with the other toes. That'll be the one giveaway for you. One of the causes for this can be because of either high arches, wearing high heels too much for ladies, and sometimes with plant twist style sports. So pretty much if you're a baseball player and you are on the mound and you are pushing yourself into that high tone position when throwing the ball very often, that can actually cause that as well. Treatment with this is going to be the same. It's going to be use some rice, use a donut pad, cushion that area so that you can protect it. Next up, we are now going to move on to interdigital neuroma. Now, this is going to be a very, I would hope, rare injury for you to see. This is more of a clinic style injury. Again, it's not very common. Pretty much you have bundles of nerves that run between all of your toes. The most common one that you're going to see this with is the third and fourth metatarsal nerves that kind of run between pretty much what would be considered your ring and middle toes. You're going to get pretty severe pain whenever you're going to try and actually widen the toes, try and put pressure on it when you're bending onto those toes, and with any type of motion that isn't considered your own. So if I were to try and move the toes or spread the toes, that would also cause you pain, not just you being the one to put pressure on it or move it around. That is the style of nerve-related injuries that we've talked about. So if you put pressure on it, it's going to hurt. Take pressure off, it's going to go away. You're going to want to do lots of massages, a lot of special tape jobs, arch supports, or any type of other form of necessary healing and rehab process in order to try and alleviate the symptoms. Again, this is a treat the symptom style injury. A lot of times people have said that massaging it daily as well as doing foot exercises have actually helped remove the pain altogether, especially when paired with nerve gliding injuries. I talked briefly about nerve gliding injuries once in the past. That's something we could talk about more in class if you would like. But moving on, we now have calluses. So a lot of us, if we've done any type of resistance training or depending on specific sports, we have built calluses on our hands that we're used to. Some people, like runners or higher intensity level sports, have calluses on their feet. Mainly, you'll see this in narrower shoe style of activities. Again, I'm talking those runners, I'm talking our track people, I'm talking our soccer players, and sometimes our football players. Those are going to be the ones that you're primarily concerned with because they have that narrower shoe and they apply more pressure to the ground during their exercises. So once you have these buildup of calluses, it's actually a good thing. A callus is meant to protect that area and protect the tissue underneath it. But what happens more often than not is the callus will actually start to grow a bit out of control because we've developed too much of this callus. Now we've developed pretty much a too solid of a mass that's not flexible. So there's kind of this chart where it's like too much callus, not enough callus. So if you have too much, you're actually going to be inflexible and you're going to have this solid tissue that's being forced from one side of the foot to the other without having any type of flexibility or movability to it, and has a high tendency to simply rip and pretty much cause a giant blister. Other forms of callus that you can actually see is if you have this big solid moving object and you're putting pressure underneath it, you can actually get yourself a small blood blister underneath that callus. And now you're actually applying a lot of pressure between the foot and the callus, and that can cause a lot of pain and pressure on the nerves, and it can make it painful to stand on. So what we will have to do actually is shave down or completely cut off that callus in order to relieve the blood and relieve the pressure that could be underneath it. A lot of symptoms that you'll actually see is pretty much obvious discoloration, obvious difference and deformity between the rest of that foot and that callus. And a lot of times it can actually be treated just by it can be treated by applying lotion, taking care of it, and once every while trying to shave it down a little bit. I know some people use a skin block. That's just an easy way to try and just smooth down the dead skin of the callus to make sure that it doesn't grow out of control. Blisters. Blisters is pretty much when you have fluid accumulating below the skin or due to friction causing a, I would say, rash formed into a wrinkle. And this wrinkle of skin will separate from the rest of the skin and can have fluid buildup underneath it due to the fact that it's no longer creating that skin barrier and is allowing fluids to actually leave the body at a higher rate. That's why when you actually open up a blister, you always seem to have fluid coming out of it. That is your body quite literally losing the water that it's been trying to accumulate and retain. Usually you'll get this type of blister either by wearing pretty much not wearing socks, wearing wet socks, having wrinkles in your shoes or socks, or just by wearing some type of new shoe. All these things pretty much are adaptability changes. If you aren't used to them, neither is your body, and then so it'll react appropriately, which is by having these rips and tears happen. You're going to see pretty much deformed skin, redness, there's going to be a lot of pain, and you're going to have a blister. Best way to reduce this, I know it says pop to reduce painful pressure. That will depend on your situation. If you have a blister and it doesn't hurt, leave it be for now because we don't want it to open up and then get infected, because the longer that blister stays open, the more likely it is to be infected. Give it time for that blister to actually heal the skin underneath it and let it pop naturally if possible in order to get you the quickest healing process without worrying about it getting infected. Now, if you do have to remove it, make sure to cover it and keep it clean. Sometimes you could use some type of zinc oxide style product to try and dry it up underneath there. That way it doesn't stay moist. When dry, remove the excess skin afterwards. That way you just don't have a bunch of dead skin hanging there. It's not actually going to protect it anymore now that the skin is removed. Best to try and remove as much of it as you can. Ingrown toenail. So this is when the side of your nail pretty much grows into the tissue or curves down and grows incorrectly. This is usually a process that happens because you cut your toenails or fingernails too short. Pretty much the shorter you have them, the more room the bed of the nail has to try and grow in differing directions. Another thing you can do actually is, instead of trying to cut your nails curved, you might actually want to try and cut them flat. That'll give the nail a bit of a board-like tendency, so if you do cut it short, it'll try and continue to grow flat, which is a good way to try and avoid ingrown toenails. Another thing that might cause this too is, again, having those narrow shoes. If you have narrow shoes, you might be pushing those toes together, and that might cause a bit more of that bending going on in that nail that could possibly cause it to curve and, again, grow the wrong way. Now, a lot of times when you have an ingrown toenail, you might actually get an infection alongside of it, and that's going to be easy to spot due to pain and redness. The redness can indicate an actual infection of the toenail after that. One thing that you're going to want to do is you're going to want to try and simply cut the nail flat, either let it grow out over time or try and get in there and pick pieces of it out. There are some doctors out there that actually go in to try and remove ingrown toenails. While it's not recommended, it's usually better to try and let it grow out or peel it so that it can grow out straight instead. Because once you kind of get rid of the nail up to the nail bed, the toenail will actually not grow back the same way, and you might have gaps, which again can cause infection. Fractures. All right, so there's a couple of fractures that you might want to be on the lookout for, but nothing too crazy. One of the ones is going to be of the joints. I know for some reason it says Jones. A Jones fracture, it actually has about 4 different styles of fracture that can happen to this 5th metatarsal bone. The most common of them, though, is called the Jones fracture. And that's usually when you roll your ankle, you're putting all of your pressure on that 5th metatarsal or your pinky toe, and that's making it likely to actually fracture. The base of the 5th metatarsal is the most likely to break out of the rest of the 5th metatarsal, and so that's usually what we will check. It is pretty easy to anatomically locate. You're going to have pain with walking, and it's going to be tender to palpate. It's pretty common because you landed on it laterally. It is easy to palpate laterally to find out what's wrong with it. Unfortunately, due to the poor blood supply in that area, Jones fractures sometimes take very, very long times to heal, months long, to sometimes not even healing at all. Again, due to that low blood supply in that area. So sometimes what will happen is if the area does not heal immediately and follow-up x-rays show minimal healing, they might actually have to go in and put some screws in order to make sure that it stays together, in a sense. Another thing to worry about is stress fractures. As it says, this can occur between the 2nd and 3rd metatarsal, usually because, again, you're having that narrow toe box that's going to cause a lot of pressure on surfaces with your increased mileage. So if we have that narrow toe box, again, putting a bit more pressure on those toes because you're getting more flexion in the 3rd, 4th, 2nd, 3rd, and 4th toes, and that's going to cause a lot of push off, again, chronic stress, like stress fractures, like we've talked about, to occur in those areas. You're going to get a lot of significant pain in one specific spot on the metatarsal. because again, those stress fractures are not across that whole bone, chain of the bone. It's actually in one specific spot along that bone that takes most of the pressure usually. Good thing about stress fractures is you can treat it like a fracture time-wise, but you don't have to treat it like a fracture in the sense of needing to immobilize fully. Usually, as long as they're still weight-bearing, you can have them continue to walk on it, but as long as they're not performing activity, you can get them back within a couple weeks.